Hey everyone, and welcome to Tiny Tribe Parents. In this video, we are going to talk about the signs that you are in labor. Now, let's begin. Number 1. If you are experiencing strong contractions. Contractions are the tightening of a woman's uterus. Contractions are what helps push the baby out. You can identify a contraction because you will be able to feel your belly getting super hard and tight at intervals. And when the contraction is over, it will soften and relax back to normal. If you are unable to walk or talk during a contraction, it's probably a good sign that you are having strong contractions. Number 2. If you are experiencing regular contractions. You are in labor when you are having regular contractions. Contractions are considered regular when the duration and frequency are stable over a period of time. An example is contractions lasting 60 seconds and coming 5 minutes apart for an hour. Number 3. Change in your positioning does not make pain go away. We often hear about the many different positions we can try. If switching positions does not alleviate the pain, there's a good chance you may be in labor. Number 4. Your water breaks. When your water breaks, you may experience a gush of amniotic fluid, or you may feel a slow trickle. The best way to tell whether your water has broken is if the fluid coming out is uncontrollable. Number 5. You have bloody mucus discharge. Bloody mucus discharge or bloody show is a sign that your cervix is changing in preparation for labor. It's always a good idea to call your doctor if you suspect you might be in labor. Hey, thanks for watching Tiny Tribe Parents, and be sure to subscribe for more incredible content that is on the way.